So I'm going to encourage folks to ask their questions. However, we did have some questions that came in on registration, and we're going to pose those to you and to us right now. Any questions that we can't get to, we have a few minutes left here today. We want to finish up right at the top of the hour, so we have approximately 10 minutes here. We will try to answer and get back to you, or we'll take them to the folks that have the answers and bring that back to you. So please make sure that you talk to us, use that chat box, use your Q&A there, and engage with us in this. So Stephen and Marie is here with us, Marie Chia, if she wants to and feels up to chiming in here. The question, this is a question that came from the people who registered. So how can researchers, and of course, as I said, 40% of those who registered actually work in public health organizations, whether it be at the local, provincial, regional, or at that national level. So how can researchers, but also practitioners and decision makers, maintain the principles of meaningful and engaged community-based work? Really, how can we meaningfully and legitimately engage with communities, given the demands within a crisis like this, where many are deployed to many other aspects of the work? So any advice for our audience? And Marie, after Stephen answers, you're more than welcome to chime in terms of what the report might provide in terms of guidance. Stephen?
First, so I think that's a great question. So great that that is actually one of the 25 top-level research priorities identified in the UN Research Roadmap. So whoever asked that question, we should have included you as part of our team. Because again, as Claire, as you mentioned, we did that in 10 weeks. So that is one of our 25 questions. And the reason it's a question is because we know it's so important. In fact, it's during crises like this that kind of community engagement is most important. But we also know it's the hardest time in which to do it because of, well, particularly in the context of a pandemic, when a lot of the traditional means of engagement, including face-to-face efforts, are much more difficult, if not impossible. And so as a result, how do you leverage technology? How do you leverage existing relationships? How do you build new ones in a sometimes totally virtual world in which some of our traditional ways of working are no longer available to us? So I don't have an answer about how to do it. I do, though, have emphasis on the importance of that question. I think what we have seen is that it highlights that we need to build in further resilience into our systems of community engagement, relying on very specific approaches doesn't mean that they'll always be available and work in different contexts. And so what that means is it requires us, when we do think about recovering better, how do we rethink our opportunities for engaging democratically with citizens, particularly those who are hardest to reach, in moments when it's hard to reach everyone, and also think about how can we ensure then that those systems are available when they're most needed. And it's not an easy question, but I think that we have started to see during this pandemic some innovations, whether it's the use of new technologies or new approaches. Hopefully we can use that experience and learning in order to leapfrog into the future, because again, I'd say we know from before the pandemic, efforts for community engagement were not ideal in many cases. They weren't perfect. And how do we then make sure that any lessons learned during this pandemic we can make use of to make those approaches even better during both peacetime as well as peak time?
And I think from my perspective, one of the perspectives is to really keep top of mind that whole of society, whole of government. And we saw that work. I mean, we've seen it work in this response to the pandemic. So intersectoral collaboration and intersectoral action is doable and can be done. And one of the thoughts that I had as you were speaking, you really need to build those relationships, nurture those relationships, do things together to address issues in peacetime so that you have those established when you're in a crisis and you're needing to mobilize and move quickly. And I know there's good stories out there, and we're really hoping as part of this conversation series to tap into some of that knowledge, Stephen, in our system across the country, and really looking to, and I was a farmer's wife for 20 years, so I'm going to use a farming metaphor, really harvest some of those really good stories of what's working, and really intentionally looking for how did they make that work? What worked there? What were those, as we talked earlier, those ingredients, right? That essence of what was going on, and then surfacing that and perhaps having a series of case studies or case stories. And next week, one of our speakers is Dr. Smita Pakali, who I know is doing some research, and hers is a beautiful story in the REACH initiative in Ottawa of real on-the-ground community engagement, but also using research as part of that, and community-based action research is really her frame, and it's so natural for her. So we're really looking forward to, in 2 weeks, having her her speak. Marie, do you want to add anything, or should I move to the second question? You just would need to unmute your mic there.
Yeah, thank you. I think the only thing I would add is that I think what the COVID experience has shown us is that there's a lot of resources and capacity outside of public health that we can really draw on. And I'm thinking about a story that I heard about, you know, with vaccination programs and trying to reach communities maybe that, you know, don't relate to the way that we're kind of giving messages about vaccines and vaccine safety. And, you know, the engagement with local community leaders, faith-based organizations, and other folks with public health in partnership has been found to be really, really helpful. And so I guess recognizing that, yes, public health is really stretched right now, but that there are lots of other, you know, resources out there that we could tap into. Claire, I think you're on mute.
I am on mute. I put myself from unmute to mute. I'm sorry. I think those two additional documents that Theresa Tam mentioned in her her presentation, what we heard from the Indigenous communities, and also that Best Brains meeting that occurred, I think those also will give some ideas around in community engagement. So I'm going to move to our second question that we had sort of, and I'm going to give it as your sort of last opportunity and your kind of final word here. But as we said, over 40% of our registrants come from public health organizations, and one of the perspectives is that often interventions for health equity, definitely looking at equity and health equity, often seem to occur at that service delivery level, or possibly quite downstream to what I think we really want to see at that structural driver of health equity and that more upstream perspective. Stephen, what do you see as the levers to change? And, you know, much of what Theresa talked about, you know, she talked about structural determinants and structural drivers. Just as a final word, as we close out today, where do you see those levers for change, Stephen? And then I'll ask Marie the same question.
Yeah, so I think it's another great question. I think we have, as the UN Research Roadmap argues, we have this generational opportunity whereby this pandemic, having served as a grand revealer of the problems that our societies around the world all have, and all differently have, it gives us an opportunity to act on them in ways that might have been more difficult before the pandemic. I mean, we all know in very real and personal terms the extent to which our health and well-being is very much shaped by the health and well-being of people immediately around us, in our broader communities, across our countries, and indeed the world. And maybe there's no better way in which this has been brought to the fore of the entire world's minds including political leaders, around how much we are intrinsically interconnected with each other. And so that, for everyone on this call, I'm sure that's old news. I mean, anyone who works in public health, equity is at the core of public health. So that's not new. But that is maybe a new insight for many people. And at least it feels very differently for folks now that they've seen it in very real terms. So I think in terms of moving forward, we do need to seize this generational moment to try to catalyze change. I think some of that will come from within public health, but also within the public health community, we need to grab in more of those allies from outside of public health, who often are not going to frame their raison d'etre around health. It might be more thinking about well-being or economic opportunity. We think of that as health, right? I mean, we know that income, socioeconomic status, highly related to health outcomes in terms of thinking from a broader social determinants of health perspective. But what that means is that a lot of our efforts to achieve health upstream is going to depend on us engaging others and recruiting allies in this process. We have no better policy window to do it than the window that's been opened by COVID-19. And so we need to seize it.
I'm 100% with you, Stephen. Windows and doors, and they are wide open there. I'm going to go to Marie, but as I'm asking participants here, if you could just type in, we're just interested in kind of taking a bit of a pulse here. If you could type in, if you have to go, and as you exit, one word that's top of your mind right now. And I want to make sure I invite you to our next session, which is on February 24th, same time. And as I said, we have Dr. Smita Pakale, and we also have Kate Mulligan, Dr. Kate Mulligan from Toronto Public Health, where they have an equity statement, and Bonnie Hustrasser from the Chief Public Health Officer, who's really going to talk to us also about what are the next stages in their reporting and in their next annual report. So any ideas, type in a word that's at top of your mind, how you're feeling, what you're thinking about, where you're going. And I'm really going to encourage those students. I see a lot of nursing students there. I'm a registered nurse myself. Glad to see you there. Please type in a few words for us. Marie, over to you, and then I think we'll close our session.
I'll just say really briefly, Claire, that I think what this conversation has underscored is that everyone, no matter where they find themselves, working in public health, everyone's role is super important in making these structural changes. The stories that, people who are working on the ground and with communities, those stories are really, really helpful to policymakers, to people like me who are trying to kind of work to make changes at the national level. Documenting those stories is really, really important. Teaming up with researchers to try to really measure that so that those stories can be shared and really quantified. And then I think forging those relationships, reaching over across outside of health, as we learn about how to actually intervene, plan differently, respond differently, it's those relationships that you are forming at the community level with those who are inside and outside of public health that are going to allow for us to make those changes. And so I would say, and I would just encourage everyone just to know that what you're doing is really important, and we're all kind of part of a puzzle together. And yeah, just thank you so much for this conversation. It's been great.
Thank you so much, Marie. And we are looking for your stories, and we are looking to lift up those stories and to really look at what's working and why it's working and how we can make that happen more often. So I'm going to close out our conversation today. Thank you so much, Stephen. I'm always so impressed when I hear you speak, and thank you so much for the good global work that you are doing on behalf of Canada. Thanks, Marie, for being here. And please extend our thank you to Theresa Tam for her very thoughtful comments today. And thank you to everybody who attended. We'll see you again, hopefully in a couple of weeks on February the 24th. Please keep your words coming in here. I see a lot of activity in that chat box. And please extend your questions and things that you might like to talk about and to be part of over the next series of 5 conversations. So thank you, everybody, and have a great day and stay safe, and we'll talk to you soon. Bye now.